Well, I'm going to bring up another doctor, Dr. Sarah Bowler. She is a naturopath. And basically, I actually met Sarah at the landmark course that I'm in, the Self-Expression Leadership Program, and she's got another community project going as well. And I was so just grateful when she was one of the first people to say she would come here and contribute to this event. And I want to say thank you there, Sarah. And Sarah is a licensed and board-certified naturopathic doctor who graduated from the Southwest College of Naturopathic Medicine, located in Phoenix, Arizona. She's relocated to Toronto in order to complete a 2-year clinical residency at the Canadian College of Naturopathic Medicine. Before her naturopathic education, she graduated from the University of Birmingham, England, with a BSc honors in natural sciences, biochemistry, and biology. She is registered and in good standings with the board of directors of drugless therapy naturopathy. Dr. Bowler's naturopathic practice offers an integrated approach which utilizes homeopathy, nutrition, and lifestyle counseling, botanical medicine, and traditional Chinese medicine as gentle, safe, and effective therapies and for the treatment of patients suffering from many acute or chronic illnesses. Sarah believes that health is the natural state of the body and doesn't come from a quick fix pill, that the mind and thoughts and how to treat yourself have a huge impact on the health of your body, and that the health of the body affects the health of the mind. That health doesn't have to feel like a hardship or a chore. It can feel like a reward you are giving yourself for choosing to live. She enjoys seeing patients of all ages, providing care for those interested in more natural, holistic approach to healthcare. She has 2 private practice locations in the city at Yonge and Sheppard and Bloor and Church. Thank you so much for joining us, Sarah. Come on up.
Thank you for having me, Justin.
You're welcome. You can stand back there is fine. Perfect. So in terms of your first question, what role can naturopathic medicine play in improving health in a traumatic brain injury survivor?
Well, okay, first off, I'd like to say that I think that naturopathic doctors are kind of like the general practitioners of alternative health. So we kind of do a mixed bag of a lot of things, but obviously also will defer to experts when we need to. And one of the guiding principles of naturopathic medicine is the philosophy that the body can heal itself, that the body wants to heal itself, the body wants to be well. So our job is to provide an environment where that's possible. So there's sort of 2 main ways that you need to be going about that. One is removing what we call the obstacles to cure. So we're taking out things in our life, in our diet, in the way we think that it might be getting in the way of us getting healthy. So, that includes things like you don't want to be in pollution too much, smoking, the chemicals that you're exposed to, whether in the home or whilst you're out and about, or what you're putting on your skin. Making sure that you don't have negative thought patterns all the time or too much stress in your life, because it's a huge burden on the body. And then also, of course, that good nutrition is a very important factor, that you don't want to be putting things into your body that are not contributing to health. And then the second part of that is of course, making sure that you have all the things in your life, in your lifestyle, that you really need, so that you're providing the tools that are going to help you to go towards that health state. And so in that, you can use a lot of different modalities. So, for example, as a naturopath, all of the things that were listed, acupuncture, homeopathy, nutrition, herbal medicine, but also all the other tools that are available to you. You've been hearing from experts today, those, physical rehab, long-term healthy, happy thoughts. And then making sure you get outside, you spend time in nature, you get fresh air, you have sunshine, and you do as much exercise as is within your grasp at the time. Mm-hmm.
I've been feeling a lot better since I detoxed, and then I've been doing the physical activity. I mean, I didn't get my 5 today. I'm going to do it later on, I believe.
Absolutely.
But considering I couldn't do 1 chin-up just a month ago, it's amazing what our body can do in terms of strengthening and resiliency. I think it's amazing.
I saw you do 3 pull-ups before everyone got here, so it's actually 7 for the day.
I want to do 5 in a row. So what would you say are the fundamental aspects of good nutrition and good lifestyle?
So most of us have heard the phrase, let food be thy medicine, right? Said by Hippocrates so long ago. So that's a very important concept to make sure that you accept and digest, no pun intended. And it sort of fits with what I mentioned before. So one, we got to remove things that are not going to be helping us, right? We only want to be putting things in our body that are going to be contributing to better health. So that's going to be taking things out that are perhaps causing extra inflammation in the body or causing the immune system to respond in a way that we don't want it to. And so there are things that some people can eat and have no problems, but they might cause problems in other people. And you sort of have to just accept that that's how it is for a lot of people. But it also, it's really simple things like you don't want to be eating junk food or fast food. You don't want to eat things that come out of a box. The closer it is to real food, the more life and power you're going to get from it. And then you also want to consider, and I hear this a lot from patients, that they feel they're doing fine with diet. They eat at least one home-cooked meal a day. They sometimes eat vegetables. Things are fairly balanced, so I don't need to change anything. Which is fine if you only want to use food as, now I won't die from starvation, right? It's just keeping you alive. But if you want food to be medicine, it's got to be more mindful than that. If you're in a state of perfect health and you're able to eat, one meal a day of absolutely perfect quality food, fine, that's one thing. But if you're in a state of ill health and you're trying to bring yourself back towards balance, you might need to do more than that, right? We're looking for ideal food, not just okay food. So in that, it's important to make each of your meals count. Everything that you eat should be contributing in some way towards your health. But also, I want to point out that doesn't have to mean, I only eat kale for the rest of my life. It doesn't have to be a hardship, but it does mean being somewhat creative about where you hide things in your foods. For example, you might make smoothies for breakfast that have got bananas and strawberries, so they're delicious, but you also put in 2 handfuls of spinach and some flax and some chia seeds. You won't notice them once you've made the smoothie, but now you've got powerful breakfast. So it's things like that. It's getting creative and it's being flexible, but also accepting that this is another tool that you have available to you, and you've got to commit to that.
And here, last night for our little table to get powered up for today, I'm famous for my homemade Alfredo pesto sauce. And now that I've woken up, I thickened it with chia seed, and I filled it with hemp hearts, and I made it with goat milk and goat cheese instead of the traditional dairy. So
awesome.
We could fool ourselves into thinking it was really
the
healthy.
Recipe.
Excellent. I made it up, so maybe I'll do that. And for the last question, what about the use of food supplements? Because they're pushed in a big way in the market space.
Mm-hmm. Yeah, they really can be. And for people who are in tip-top health and eating an ideal diet, perhaps they're not necessary, right? It's not like everybody needs to be on a food supplement or 10 food supplements for the rest of their life. But, going along the lines that food is medicine, a food supplement is basically really concentrated food. So you're taking the nutrients from the foods and concentrating them in pill form. So they have their place. They provide something that you sometimes need. However, it is very individualized. So it's not like I could say, everybody who has a traumatic brain injury needs to be on this supplement. It doesn't really work that way. It depends what symptoms you're experiencing, whether you have any dietary limitations, if there's certain metabolic pathways we want to be, encouraging in the body. So really, for that, I would recommend that you see someone who's an expert in that to get an individualized, tailor-made program with it. But I would also say be wary of anyone who tries to put you on too many things, because it shouldn't really be necessary. Right, and then there are a few nutrients that have been studied in traumatic brain injury. And without getting into too much detail here, these are just some things that you guys can research. Omega-3 fatty acids fish oil is one of the things that has been studied extensively, and it seems like it can decrease inflammation in the brain. So you can choose to eat more oily fish in your diet, or you can supplement it because it has a lot of other health benefits too. Another really great one is something called alpha-lipoic acid, which is one of the few substances that we know that can cross the blood-brain barrier, which is a very tight barrier between your body and your brain. And it seems like it reduces the impact of oxidative stress that happens a lot in traumatic brain injuries. So, you know, a lot of what you read also says we need more research, and we do, but it's encouraging to see that there are things that you can do with nutrients as well.
Well, thank you so much, Sarah.
Very
you know,
welcome.
I much appreciate it. Thank you.